what we have here is a patient. She's feeling intermittent numbness in her left arm with lateral flexion, and she actually has less numbness, correct? It goes away. So that's, at least that rules out any true disc or, sometimes the numbness, they can get the weird sensation. It could be facet. If you see lateral turn to the left, turn to the right. So she's very restricted on her right rotation. So that would indicate possible tension in this anterior quadrant. You could see her shoulder actually, if she just even sits normally. Her left shoulder sits more anterior than her right shoulder. So now we have to think of what will be our highest value node, our greatest bang for our buck. Found with motion palpation at around, I'd say here's her mastoid process, here's C7, so you're looking around the mid-cervical spine. So you could ballpark, if you have to call it something, around C3, C4, even though the brachial plexus is a little bit lower, and that's primarily what's being entrapped in the muscles, that's actually right there, and you can see with very, very gentle palpation, it elicits a slight response. So what I'll do is, this is a basic, but one of the most valuable needling techniques, a very good facet needling technique. And very gently and slowly. And the goal is for the patient to feel nothing. Do you feel anything?
Mm-mm.
You can see. I'll turn that down just a tad. Is that comfortable?
Mm-hmm.
Just let that shake things out. And you can see even brings back, it's got the multifidi deep there. It's got the splenius. Let's see if it's got a little, no. It's even got little fibers of trap superficially. And you can see how it brings the neck back, stimulating all the deep fibers there, just very gently. Again, my stimulator's on one of the lightest settings. Comfortable?
Yep.
And we just let things reset and shake up in that area, and then we could retest. And the needle comes out with much less restriction. Now, we reassess, always reassess after you treat, and rotate to your left, rotate to the right, and the rotation is better. Now let's see on lateral flexion. Lateral flexion, okay, good, and actually both have significantly improved, and that's a great initial assessment and initial treatment, and the patient follow up with the next visit.